I welcome you back to another important lecture. And for today's class, we will see that what are the heart diseases with us and how we can be correcting these heart diseases. And if some person has developed these heart diseases, then what strategies do we have with us in order to be correcting them? But before I teach you to this concept, so what we believe is that the human beings they would die immediately if their heart would fail or if there would be the failure of the lungs, or by some mean if the brain would fail for any human being, so their death would be very rapid. Like in other cases where the kidneys they are failing or some other pancreas are failing, the human beings they still have a chance for a treatment or they can go for a transplant, organ transplant. But if these three functional organs they would fail, then the human would die immediately. So this means that we must be very much aware that what the heart diseases actually are and what we can do to be treating them or correcting them. So for our course, we would be looking on toward this major heart disease that we have with us, and this is entitled as a coronary heart disease. So since the word is coronary, so our idea of the word coronary should be very much clear, and we know in the previous lectures I have taught you that when we try to be looking on toward this heart, so this is a living organ, and in the heart, the situation is that there would be the presence of these muscles, and these muscles they are the cardiac muscles. And these cardiac muscles they keep on contracting and relaxing, and for that purpose, we are in the need of the energy. And energy can only be produced within these cardiac muscle tissues when we would provide the heart muscles with the glucose and the oxygen gas. And at the same time, there is a chance that the heart muscles they would be producing some waste material like the carbon dioxide gas and the stuff like that. So they also have to be removed. So for that purpose, and the heart, they are supplied with these arteries that we have with us, and these arteries, they are the coronary arteries. And the purpose of these coronary arteries is that they should be sufficiently carrying the blood, having the nutrients and oxygen gas to the heart muscles, so that our heart can keep on working normally. But there happens to be some situation where these coronary arteries that are the miniature blood vessels that are transporting the oxygen and the nutrients to the heart muscles, so they would become clogged up or they would become blocked with a kind of a thing that we refer to this as the plaque. And by that, the supply of the oxygen and the nutrients to the cardiac muscles would be compromised, and the person would start suffering from this disease. And the name of the disease is coronary heart disease with us. And if this is not corrected timely, then it can lead to the heart attack, and for sure it will be killing the person who is suffering from this scenario. Now, if I were to be showing you that what happens when we have a normal flow of the blood going to these muscles, cardiac muscles of the heart, and when there would be the deposition of the plaque or the fatty material. So if you were to see in this diagram, so here I have got this coronary artery, and in the coronary artery we have this empty space where the blood is flowing, and this is referred to as a lumen. Through the lumen, the blood would flow uniformly, adequately, and in that way, the supply of the nutrients and the oxygen gas would be adequate to the cardiac muscles. But this is in case when we have a normal working of these coronary arteries. Now, it so happens as that for those individuals that have got an issue of the high blood pressure, then this flow of the blood or this pressure of the blood would be immense, and ultimately this would start to create some kind of a stress on toward the inner walls that we have for the coronary arteries. And by some mean the inner lining that we have in the coronary arteries, which we refer to this as endothelial linings, it would be damaged. And the body would bring about the repairing mechanism, and by that repairing mechanism, the thing would be that we would start to develop these plaques within the coronary arteries, and this phenomenon overall is referred to as atherosclerosis. And when the atheromas or the plaques, when they would deposit in the lumen of the coronary artery, so you see that overall the lumen is decreasing, like the space through which the blood has to flow. So this is decreasing. So when this would be decreased, then as a result of that, the supply of the oxygen gas and the nutrients to the cardiac muscles, this would be reduced. And when this is reduced, so the heart muscles they begin to weaken. And during that time, the situation would be that the person he occasionally would feel the pain in his chest when he would do some kind of an activity. So that situation is referred to as angina pectoris. And by that, the person should get to know that he has got some issue going on with the heart, so he should consult a cardiac surgeon or a cardiac doctor. So this is how this coronary heart disease can initially be weakening the heart and later it can cause a person to die or it can lead toward the heart attack. So here the explanation is written that once a person he has a coronary heart disease, then how it can lead toward a situation of the heart attack. So the thing is that when this atheroma would be deposited in the coronary arteries, then the lumen would be decreased. And when the lumen is decreased, so the supply of the blood to the heart muscles is compromised. And the heart muscles initially they would begin to weaken up. Again, and as I have repeated earlier, I'm repeating it again. As I mentioned it earlier, so the situation here when the person would have the chest pain, so this is angina pectoris. And over time, the coronary arteries they would become completely blocked. And as a result, the cardiac muscles they would die completely. And when they would die completely, at that point, the person would get the heart attack and it would kill that person in most of the cases. Occasionally, some people they survive the heart attack. It would depend upon how much severity of the heart attack there is, or how much damage the person has got for his coronary arteries and in context of the cardiac muscles that he has. Now, this actually is not uh, frequently asked in the exam, but we must be clear about it. What strategies do we have with us if we were supposed to be treating this coronary heart disease and the person has developed it? So, initially, the doctor would choose to be treating the patient with the medicine, but in some cases, the medicines they do not work in such a way as to be overcoming this problem of the coronary heart disease. So they take the patient or the person into the surgical interventions. And in the surgical interventions, we have got this situation of an angioplasty. And then the other way, where the person has got a very severity with the heart disease, so he would be performed an open heart surgery, and this is referred to as coronary bypass surgery. Both of these methods they are invasive, but the open heart surgery where we do the coronary bypass graft, so that is more invasive as compared to the angioplasty. But the scenario would be that in angioplasty, the place where we have got the blockage in the coronary artery, we would try to widen it up. And in the coronary bypass surgery, we would provide a different route or a different passage to the flow of the blood so we can bypass that area where the blockage actually is. Like if I were to show you a rough diagram here, so if I were to say that this is a coronary artery and over here I have got this blockage. So what I would do that I would make an alternate route for the blood to flow. So here we are basically making a kind of a bypass for the blood to be bypassing this blockage. And this would again be saving the cardiac muscles from dying. Now, if I were to quickly show you the protocol for the angioplasty, so here you see that we have got a blockage here. So what the doctor do? They basically place the catheter into the main, you could say, blood vessel of the body, and then with the help of the ultrasound, they guide this catheter to where the blockage is. Once the catheter has reached the place of the blockage, then here we have got a balloon attached, and that balloon would be inflated. And when the balloon is inflated, so as a result of that, this narrowed passage or the narrowed part of the coronary artery would be dilated. And once we have dilated this passage, and there is a slight chance that they can again constrict. So in order to avoid that, what the doctor they do is that they would be adding a kind of a metallic mesh here, and that metallic mesh is what we refer to this as a stent. So when the stent is placed, this would reduce the chance of these coronary artery collapsing again once we have corrected them by inflating the balloon that we have inserted at this point. So in the angioplasty, what we do is, as I have told you in the diagram, that the doctor would take a catheter and he would insert it into the major blood vessel. In order to reach to the point where the blockage is, he would be guiding this catheter with the help of the ultrasound. And when this guided wire has reached the point of the blockage within the coronary artery, then at that point, this balloon would be inflated and that would widen the blockage. After we have widened the blockage and the lumen has been retained to the original size, now the doctor would place a metallic meshwork and that is a stent. and this would further prevent the narrowing of the coronary arteries again. So this was angioplasty with us. Now the other situation is that we have got this situation of the coronary bypass surgery, or this is coronary artery bypass grafting. Now, if you were to look here at this point, so we have this blockage coming here, and this is minimizing the flow of the blood to the cardiac muscles. The doctor, they saw this situation and they concluded that the severity of this blockage is so that we can't perform the angioplasty. Rather than we have to be putting the grafts here, we would try to be bypassing this blockage that we have here. So for that purpose, what the doctor they do is that they would open up your chest cavity, they would cut the sternum, and finally they would reach to where the heart would be lying. Then from the usually from your hind limbs, the legs that we have. So from there they take these grafts off the vein and then they try to be making a bypass. And when we would try to be making the bypass, so we take the blood supply from the aorta, and when this blockage would be bypassed, and ultimately the heart muscles they would start to receive the supply of the oxygen gas and the nutrients for again, and they would somehow retain their function of contractions, and in that way the person problem would be resolved. Now here are some of the risk factors that we have to talk about that can be enhancing the chance of person developing these cardiac diseases. So the first and the most appropriate factor is a poor diet. Now if you were into eating a lot of the animal fat like the cheese and the cream and the stuff like that, then within the coronary arteries, the plaque would develop more. They would be deposited more, and ultimately you would have a greater chance of developing the heart disease. The other scenario is stress, and you may have seen that in the daily life, the person, those who are overstressed, so they die at a young age. And the situation is that when we are exposed to the stress, then the body's hormonal control is interrupted, and the hormones by some mean or the other they are regulating the blood pressure as well. So when there would be the hormonal disturbance, so the blood pressure in the body would increase, and when the blood pressure in the body is increasing, so the blood would exert more pressure on toward the lining that we have for the coronary arteries, and the chance of developing the coronary heart disease would be maximized. And how can we not talk about this situation, the people, those who are into the smoking situation? So the smoking, the person, those who do it, so in that there is a drug, and that chemical is basically the nicotine with us. And what this nicotine is doing is that this would be constricting the blood vessels of the heart, and by that, when the lumen of the coronary artery is becoming narrower, so for sure the blood pressure would be enhanced, and the blood pressure would be enhanced, and ultimately again the inner lining of the coronary arteries would be disturbed, and as a result of the repairing mechanism, the body would start to develop a lot of fat globules, and again, the person would have this coronary heart disease developing in them. And then again, there is a situation of the genetic predisposition. You may have seen in the daily life that the people around you they have got a lot of relaxed life, they are into the exercise, they are eating good, but since they have got the genes coming in their family from the parents to the offspring, and they are at a greater risk of developing these cardiac diseases. Age is another factor. As we age, we become old, then you see that the blood vessels they have an ability to dilate, and they have an ability to constrict, and by that they would be regulating the flow of the blood going to the organs. But when we age with time, then this recoiling of the blood vessels is minimized, and when this recoiling would be minimized, then again the sufficient supply of the oxygen and the glucose to the cardiac muscles cannot be properly attained. And likewise, here we have the issue of the gender. So the male individuals they are thought to be developing, or they have a greater chance of developing the coronary heart disease compared to that of the female. Now, if these are the risk factor and they have an impact on developing the heart diseases, then the situation is that how come we reduce the risk of developing these coronary heart diseases? So the person who is smoking, they should quit smoking, the nicotine level would be reduced, and ultimately the damage to the heart would be minimized. And if there was a person who was more into eating the animal fats, so instead of depending on eating the animal fat, he should be eating the plant fats. And then again, the regular exercise is very important, because when we are properly exercising, so we would have a weight loss, there would be decrease in the blood pressure, there would be a frequent or a uniform kind of the blood flow going to the heart muscles, the cholesterol level would remain within the limits, and this would also help to reduce the stress. So you see that by simply the exercising, we are minimizing the impact of various risk factors that are associated with the development of the coronary heart disease. Now coming toward the end of this lecture, that how can we actually monitor the activity of the heart to see that whether our heart is working properly or if this is working abnormally, then what procedures or the protocols we actually have to follow. So if I were to see the heart activity and I have to monitor it, then we can use this machine, which is ECG. And we can also be measuring the pulse rate. Like the pulse rate simply means that for 1 minute, how many of the heartbeats we are producing, or simply the doctors they have got a protocol they have with themselves, the stethoscope that they keep on hanging in their neck. So by that stethoscope, they would hear to the sound of the valves opening and closing. So if the readings of the ECG and the pulse rate and the sound of the valves they are normal, then this is an idea or an indication that our heart rate is normal, so our heart is performing well. And as I have said, the heart rate or the pulse rate is measured in terms of the beats per minute. And normally they are like around 70 to 80, but if they would go beyond that, so this would indicate that the heart is activity is lowering with the time. Now, if I were to see the effect of the exercise on the heart rate, then what I'm required to do is that before taking any person into the exercise, I would be measuring his pulse rate before the exercise. And when he would start to exercise, then every minute, I would again be checking his pulse rate. And we would see that when the exercise would be performed, then the heart rate or the pulse rate normally increases because the need of the cardiac muscles for the oxygen and the glucose would increase, and at the same time, the skeletal muscles that are working when we are exercising. So, in order to be supplying them with the sufficient glucose and oxygen gas, so this heart rate or the pulse rate has to increase. So, I hope you would be clear with the heart diseases and you would be very much clear with the risk factors that we have for the developing the coronary heart disease and in terms of how we can monitor the activity of the heart. So see you in the next class.